Hello. Hello, my name is Lena. I'll be your midwife. Now I'd like to speak to you about family planning. Can I ask you to confirm with me your age? I'm 27 years old. How many children you have? I have 2 children already. My first baby is 4 years old. Then I have an 8-month-old baby. Did you use any family planning method before? I used the breastfeeding method, then a tablet. But because I forgot many times, I got pregnant. I can explain to you all family planning so we can choose the most appropriate for you. Contraception. Definition. Contraception, birth control, prevents pregnancy by interfering with the normal process of ovulation, fertilization, and implantation. Methods for women. Variety of options available to women. Hormonal. Combination hormonal or progestin. Only. Pill, patch, vaginal ring. Injectable. Long-acting. Depot or implant progestin. IUD. Copper or Levon or Gestrel. Barriers. Barrier methods. Condom, diaphragm, vaginal cup, spermicide. Surgical. Sterilization. Female, male. Natural. Fertility awareness, withdrawal, calendar method, body temperature method. Hormonal methods of birth control, types. Combination hormonal, progestin only. Pills. Estrogen and progesterone or progesterone only. Prevents the release of a mature egg. Thickens cervical mucus. Changes the lining of the uterus. Typical effectiveness rate is 91%. Advantages. 1. One of the most effective reversible birth control methods when taken correctly. 2. Simple and easy to use. 3. Regulates menstrual cycle and reduces cramps. 4. Reduces the risks of endometrial and ovarian cancer. Disadvantages. 1. Must be taken every day and at the same time every day. 2. Can be affected by smoking. 3. Other medication can interfere with effectiveness. 4. Has many side effects. Nausea, weight gain, headache, etc. Combination oral contraceptive health risks. Venous thromboembolism, VTE, stroke, myocardial infarction, metabolic effects. Transdermal patches. The transdermal patch has a combination of both estrogen and progesterone in a form of a patch. 1 patch applied weekly times 3, then removed for 1 patch-free week. Vaginal ring. Soft and flexible ring inserted into the vagina. The ring slowly releases hormones while in the vagina for 3 weeks. 1 ring inserted and left for 3 weeks, then removed for 1 ring-free week. Depo-Provera. Injectable contraceptive. An injection of progestin administered every 3 months. Menses may not return for months after discontinuation. Return to fertility may be delayed by 10 to 18 months after discontinuation. Advantages. 1. One of the most effective reversible birth control methods available. 2. Does not contain estrogen. 3. Effectiveness is not reduced by other common medications. 4. May be suitable for breastfeeding women or women who smoke. 5. Improves symptoms of endometriosis. 6. Reduces the risk of endometrial cancer. Disadvantages. 1. Initially, irregular bleeding is the most common side effect. 2. Decrease in bone mineral density, which may be reversible when a woman stops taking the injection. Calcium supplementation is advised. 3. The lack of a monthly period. Implant. Etanogestrel 68 mg. Non-biodegradable rod implanted subdermally, left in place for 3 years, then removed and replaced if desired. Overall, 3-year failure rate is 0.38%. Return to fertility after removal is within days to weeks. T-shaped device that is inserted in the uterus by a doctor or nurse practitioner. 2 types of IUD, the copper intrauterine device, no hormone, 10 years of use. Cumulative 10-year pregnancy rate is about 2%. The Levon or Drestrol, releasing intrauterine system for up to 5 years of use. Cumulative 5-year pregnancy rate is less than 1%. Typical effectiveness rate is 99.8%. Advantages. One of the most effective forms of birth control. Reversible. Can be in for 3 to 10 years depending on type inserted. Low cost when averaged over duration of insertion. Option for women who are breastfeeding or cannot take estrogen. Reduces risk of endometrial cancer. Disadvantages. May cause irregular bleeding, spotting when first inserted. Pain, discomfort during insertion. Rare risks with the insertion could include infection, perforation of the uterus, or expulsion of the IUD. Provides no protection against STIs. Advantages. Very low dose of hormone. May make periods lighter with less cramping. Many women won't get a period 6 months after insertion. Improves symptoms of endometriosis. Disadvantages. Risk of hormonal side effects, acne, headaches, breast tenderness, changes in mood. Irregular bleeding, light or no periods. Some think of this as an advantage, others think of it as a disadvantage. Barrier methods of birth control. Male condom. Inexpensive, available without prescription in various sizes. Failure rate is about 15% over the first year of typical use. Barrier methods. Female condom. Much more expensive than the male condom. Acts as a vaginal liner, with end of sheath remaining outside to cover vulva. Failure rate is about 21% over the first year of typical use. Sponge and spermicides. The sponge is a soft, disposable device with a spermicide. Typical effectiveness is 76% to 88%. Fits over the cervix. Traps and absorbs sperm to increase effect of spermicide. Spermicide disables sperm. Effective for up to 12 hours. Typical effectiveness is 88%. Surgical methods of birth control. Surgical contraception sterilization. Female. Tubal sterilization. Actions taken on the fallopian tubes. Ligation with excision, occlusion with rings, clips or insertion of coils, and electrocoagulation, cautery of portion of the tubes. Does not cause changes in menstruation. As an ambulatory procedure, is performed in about 50% of cases, mostly laparoscopically. Done transcervically by tubal occlusion, as an office procedure. Natural conception method. The natural family planning methods do not include any chemical or foreign body introduction into the human body. Abstinence. This natural method involves abstaining from sexual intercourse and is the most effective natural birth control method with ideally 0% fail rate. It is also the most effective way to avoid STIs. Calendar method. Also called the rhythm method, this natural method of family planning involves refraining from coitus during the days that the woman is fertile. According to the menstrual cycle, 3 or 4 days before and 3 or 4 days after ovulation, the woman is likely to conceive. The process in calculating for the woman's safe days is achieved when the woman records her menstrual cycle for 6 months. Basal body temperature. The basal body temperature is the woman's temperature at rest. The BBT method has an ideal fail rate of 9% and has a typical use fail rate of 25%. Cervical mucus method. When used, typically it has a fail rate of 25%. Lactation amenorrhea method. Through exclusive breastfeeding of the infant, the woman is able to suppress ovulation through the method of lactation amenorrhea method. Coitus interrupts. This is one of the oldest methods of contraception. The disadvantage of this method is the pre-ejaculation fluid that contains a few spermatozoa that may cause fertilization. Okay, I think I will choose the IUD. Thanks.